Chastity Oaks, and I'm owner of Arise Health Institute in Villa Rica, Georgia.
Okay, Chastity, could you do us a favor to give our viewers a point of reference? Where are you from, and then where are you based out of?
I'm from Carroll County or Villa Rica area, and that's where I'm based out of. So that's about 45 minutes west of Atlanta on I-20.
Okay, so kind of in that gray area, not quite the outer rim, because we know Alabama's like about 5 minutes down the street.
Right.
We're being a little sarcastic. We know it's...
For us, it actually pretty much is 5 minutes.
Okay, I was being sarcastic and accurate, about 5 minutes down the street. Early on, when you think back as part of your professional journey, what were some of the things that really piqued your interest in regards to, hey, I think I might want to pursue this or pursue that or what have you?
Well, originally I was teaching and I needed to take like a second job just to earn a little extra cash. So I decided to do personal care. And my first patient ever was a quadriplegic gentleman, and I was there helping him, and the light bulb went off in my head to say, I really want to pursue healthcare a little bit more in depth. And that's when I decided to get my certified nursing assistant certificate.
And that's interesting that you say that, because we know healthcare obviously is important. It's something that is still a growing field, but it was just that personal and professional experience that's like, hey, this is my calling, or this is where I need to pivot.
Exactly. It was just being able to be there for him and perform those activities of daily living, is how we coin it in the healthcare industry. Just being able to help him get up out of bed and into his wheelchair, and then seeing that transition from him being completely incapacitated to being in his chair and then having the freedom to do what he needed to do. And I felt very, very comforting that I was able to help him do that.
Wow, that's awesome. So not only, like you said, looking at through the lens of being a professional, and a lot of guests also talk about that stewardship piece.
Right.
So now that you've got that experience and now that you've got that nudge, walk through with our viewers some of your next steps that were taken as you continue to go down this career path.
So from that point, I decided I signed up for a CNA course. I took that. And then from that point, my first job in healthcare after that, or I should say my second job in healthcare, was doing home health care. And from that point, I worked as a home health aide, which is slash CNA also.
Okay.
But I got to the point where I felt like my hands were tied. I wanted to do a little bit more for my patients. I saw the nurses come in on those home care visits and be able to, dose their medication, give them healthcare education, give them those things that I wasn't able to do. So that made me want to go a little further and become a nurse.
And you're saying a lot right there, because there's already, for lack of a term, a good amount of moving parts just within, I'll say, one area, one realm. Mm-hmm. But then you saw it to be like there's more that can be done. So describe to our viewers, as many moving parts as there are just in that one realm, describe those next steps. Describe that additional push where you're like, you know what, there's more that I can do.
Well, for me, it wasn't an easy journey for me, because I took the long route. At least that's the way I like to look at it, because I went from CNA, and then I finally I applied to get into nursing school, and I had been out of school for so long. I had to take an entrance exam. I didn't quite score high enough originally my first time around to actually get into the RN program, but I got into the LPN program.
Okay.
So I started in my LPN program, and then my family situation changed to where I couldn't finish the LPN program. I had to sit out of school, so I was upset about that. However, I sat out a year, and then after that year, I was able to go back. So I reapplied.
Okay.
To get back into school. And they were like, you have to take the entrance exam again. So I was not happy about that I had to take it again.
And I'm going to pause you right there, because everyone thinks, I can't say everyone, a number of people think, oh, you got here and all you did was A, B, C, like it was linear. But like you said, you kind of went through all the different shapes of geometry. So like rectangles, squares, ovals, ellipses, whatever. So you really, for lack of a better term, took that, the circuitous route.
Yeah, absolutely. Yes,
so
absolutely.
Walk through with us again. You got started, had to take time off. You're ready to get back, and it's almost like you have to start back all over again. Walk us through I'll say the adjustments that you made in order to maintain your focus and still keep that larger goal in mind.
Well, I had to have a lot of self-talk that I could do it. I went back in there, I took the exam again, and lo and behold, I scored high enough to get into the registered nursing program. So it actually worked out well for me.
Oh, wow.
That little bit of a setback actually put me a little bit more forward for me, so I was able to get into the registered nursing program from there. And then even that was a struggle just because I had 2 young kids at the time, a husband at home, so I had a family situation to take care of and still get through nursing school.
So even in the midst of moving parts, when you think about through the lens of professional education, family and all that, and even though, like you said, you had a couple of delays, and a number of people have said this, and you've probably heard this, delays don't mean defeat.
Right.
So walk through with us as you're continuing to maneuver through your continued growth and your continued progression.
Well, in the nursing, any nurses out there know that a nursing program is very strenuous. So I had to do a lot of, I just stayed focused on the end result. And I encourage anybody in any type of situation where you just stay focused on the end, because you'll get there. Then everything else, you'll make it happen, make things work to where you can accomplish your goal. So while I was in school, I hired people to help me take care of my children, and to just made things work so I could get to the end result.
Okay, so with all those moving parts and all those things in place and all those, we'll say, delays, excuse me for lack of a term, you finally get to your destination. So now that you get to your destination, it's the proverbial what's next.
Yes. So I finally graduated. Fortunately, I had, at the time, I had switched from home health care to working in the hospital as like a patient care tech. So I was able to kind of make that transition from personal care tech to registered nurse after I passed my licensing exam. But then my next hurdle was the nurse bullying. So I had to deal with that for at least a year.
Wait. We're going to pause here because now bullying, the first thing I think about with bullying, and we know how it sometimes goes on in elementary school, middle school, and high school. You mean there's a professional form of bullying too?
Oh yes. We have a saying within the nursing community that the nurses, sometimes will eat our young. I think things are starting to change where we're not doing that as much, but it used to be almost like, I think the other nurses felt like it was a rite of passage to kind of give the new nurse a very hard time, where the nurse is leaving crying almost every day and feeling defeated. However, I had another nurse that was kind enough to me to kind of latch on to me. Her name was Lenora Hausman, actually, and just kind of helped me get through that transitional phase. And I made it through, and it came out a stronger and better nurse at the end of it.
Okay, and after getting through that hurdle, so it seems like, did you run like track or something growing up? Like, cause it's like you've gone through like the 110s and then the intermediate hurdle. So like you and these hurdle things, like, is that like part of who you are or something?
Evidently, so I'm a good jumper, evidently.
So after getting through that first year, describe to our viewers some of the continued things that you were able to do, and then that next pivotal moment into where you are right now.
It just seems like it was one thing after another, because after I made it through the first year of nursing or so, I went through a divorce, so that's never anything that's an easy thing to get through. And then I'm moving states, so I moved from Indiana to Georgia, and then I had to get reacquainted, and I did that actually during my divorce, so I had a lot of people helping me out through that time period too. I had friends that actually owned home health companies to help me out, and her name was Barbara Allman. She helped me when I first got here, and then I got hired on at Cancer Treatment Center. And from there, I worked there about 6 months, and then I was put into a supervisor position. So that got me into a different style of nursing from that point. And I enjoyed it, but when I was in that supervisor position, I just felt that I was going to be able to, I guess, impact nursing on that end of things, but I still didn't feel fulfilled for me personally. And that's when I started looking outside the box to see what else I could do.
And it sounds like and we've heard this term, there are different levels to this. So it's almost like here's your goal, work through a couple of, delays or what have you, you get there. Now that you're there, it's like you're doing a solid job, but you're like, there's more.
Exactly.
So describe to us, after getting at that supervisory level, describe to us your next pivot in regards to what you're doing now.
Well, my next pivot was I wanted to offer others what I had, because most nurses out there they started off as CNAs, or even some other healthcare professions. They started off as CNAs. It's like get your foot in the door. And even now, some colleges are even requiring that you be a CNA before they accept you into the nursing program. That's just how important that basis is for people, foundation. So I wanted to be able to offer others the same opportunity that I had. Start off as a CNA, see if that's what they want, and then just grow from there.
Okay. So after that realization, things along those lines, walk through with our viewers now with what you're doing through Arise Health Institute.
So what I'm doing now, I am actually in the process of, I'm working with the state of Georgia. I'm trying to get my full accreditation, which is, anytime you work with the state, it's a long process.
Yeah.
But I'm working with the state of Georgia right now so that I'm able to be an accredited school and be able to train nursing assistants to become certified nursing assistants and take the national board test. And once they do that, they'll be able to work in any hospital, nursing home, home health, private duty, many options. And then from there, if they'd like to take it further, they can also look into the nursing programs.
And that's awesome that you're making this next step, because it's a combo of preparing that next generation of healthcare professionals.
Exactly.
It's also, to a degree, stewardship and outreach, because you're trying to do what you can to equip people. And that's really on both ends, not only as, let's say, the professionals that you're training, but also the people that you're serving. So you're blending so many different things. So it's not just through the lens of business. It's not just through the lens. It's like the things are not exclusive.
Right.
Like you can merge those. Now, I know from what I recall, this coming Sunday, there's an event that you're involved in. Could you describe to our viewers a little bit of the particulars, date, time, location, as well as some of the things that are going to make this something to definitely circle on their calendar?
Sure. This Sunday at Antioch Baptist Church in Carrollton, Georgia, there's going to be a wellness fair. Tanner Hospital is involved. Let's see, Rose's Cafe. Trying to think other people that are going to be there. We have a mental health profession, which is a professional that'll be there talking about mental health, which is really good, especially within our community. A lot of times people do not want to talk about mental health, so that'll also be good. I will be there since November is Diabetes Awareness Month. I will be doing some basic diabetes education and things, what to look for as far as finding out if you might be a candidate for diabetes and when to go see your doctor. But that is this Sunday, November 17th. It's at Antioch Baptist Church in Carrollton, Georgia, and the time that it's going to start is going to be at 9:55.
Okay, 9:55. So you remind me of an instructor I had, and we would always do practice, but he'd give like the most unusual times, like 5:38 and like 2. I mean, you made it so it's a time that people can remember.
Yes, 9:55.
That is awesome. Well, look, you are covering a lot of ground. Seriously, you're covering a lot of ground, and you're making sure the next steps with the Institute to make sure to equip future professionals. You're still engaged stewardship outreach with what you're doing this Sunday. That is also very critical. What aren't you doing?
Well, I have 2 teenagers at home. I'm getting them taken care of also. So I'm doing a lot, but by the grace of God and just with my family support and friend support, I'm able to get through it.
And that's awesome that you say that, because a number of us, self-included, we have mentioned his name a time or 2 on here. So as we're getting ready to gradually wind down your segment, of course we're going to bring you back for the group recap. Could you let our viewers know the best ways to connect, stay engaged, and stay informed, so that way as people are more aware of the resource that you're providing through the Institute, as well as other things, they can get plugged in and get connected.
Sure. You can follow me on Instagram at arise_health_institute. You can also go to my website at just www.arisehealthinstitute.com. And on there, under the contact us, you can put your email address in, and it'll come directly to my email box. And then we can get you on the newsletter and keep you informed about what we have, what we're offering. And hopefully I can invite everybody to my grand opening at the beginning of the year, and we'll go from there.
Well, we're just going to go ahead and put that out into existence.
Absolutely.
And everything. Chastity, thank you for taking and making the time and sharing your story of impact. I know that there are people out there that needed to hear what you were sharing today. So what we're going to do, ladies and gentlemen, we're going to take a quick commercial break, but during the break, here's a hint. We encourage you to go ahead and get on those phones or your laptop or what have you. Go ahead and add, support, and connect. So we'll be back in a couple of moments after our commercial break. This is Conversation Corner.
Yeah.
Wait,
Very
what are you
good.
worried about?